Welcome back. We love having Marshall Lifestyle in, and today we want to talk all about their aesthetics program. So we have physician assistant and expert injector Lauren Mead here with us today. Thank you for coming in.
Welcome, my friend.
I'm so excited to be here. Thank you for
Nice
having
to
me.
see
Absolutely. Yeah.
I have to say, I love your work already. I follow you on social media. She has the best Instagram before and after pictures. So we really want to know what you do. Can you start by just telling us what's your role over at Marshall Lifestyle Medicine?
Absolutely. So at Marshall, I am sort of over all of the aesthetics division. I kind of run the program there. So what we do is comprehensive aesthetic analysis of every patient who comes in and who's interested in aesthetics. So we have a Visia system, so we can scan the skin and we can kind of figure out what a patient's unique needs are in terms of volume, in terms of skin tone and texture, and things like that, discoloration, pigmentation. So we use that tool, and we also assess a patient visually ourselves and decide sort of what their unique needs are, because every patient's different.
Yeah,
so.
and I would assume you'd be looking at people's face shapes, and when you're saying about the volume that you need to increase, or also with the jawline. What is interesting is, you know, we're looking at some of these pictures up here. Now, this gentleman had some filler done underneath his eyes.
He did. That's called a tear trough deformity. You see kind of the hollowing under the eye. And we were able to just put a product called Restylane there to support that tissue and to bring it back into proper placement. So look how much younger he looks. I mean, it looks like we took about 7 years off just by doing that simple treatment.
And
it took about 15 minutes.
I have to say to you, having that done under your eye, it is an incredible thing to have done.
Absolutely.
I love it.
He looks great. So what are some of the other treatments that you offer?
Absolutely. So in addition to replacing volume that's lost, sometimes people have an excess of volume, like myself.
That was just funny. We're not laughing at you.
No, I had actually Cabela done on myself, and you'll see that that picture later, perhaps.
In a little bit.
Yeah.
We're looking at some lip injection
Yes,
here.
that's
I
a before and after of a patient who had Juvederm placed in the lips. So
how long does it last?
Very natural. Usually in the lips, your filler's going to last about 4 to 6 months. It's just because we metabolize the product really fast when it's in the mouth. We move our mouths a lot. We're talking, we're eating, we're smooching, things like that.
Yeah.
So the product gets metabolized
They
more
say
quickly.
having the lip is one of the most painful. Is that?
You know what? It is a little bit painful, but we do a lot to reduce the pain of our treatments because we put on a topical numbing cream, and we also ice the lips beforehand. I can do injections for the patient of a lidocaine if they really don't want to feel anything, but it's a teeny little pinch, and the benefit they get is so beautiful. Most patients can easily endure
Here's
that.
another example of what you're
saying.
saying.
Beautiful
I
lip
will
result.
say to you, they do look a lot more youthful. The
Absolutely.
lip. Don't you agree?
See how the lines in the first one become effaced when you place product in the lips? It just kind of smooths it out, and it's almost like a natural lip gloss. It's
so
beautiful.
what do you say to people if they're a little bit scared, like?
Me.
Because I'm trying to get her to have, I shouldn't say I'm pushing to have something done, but I just want you to have that experience.
Absolutely.
So what do you say to people who, I guess then like me, we think we want a little something done, but you hear people say, oh, you're too young, you don't need that. Are you? And then you're afraid of looking overdone. What do you say to that?
Well, I hear that a lot because unfortunately there are a lot of examples out there of bad work. When you see someone who you can tell has had something done, it kind of makes you a little, you know, nervous to do it yourself because you think, I don't want to look like that. I don't want people to know that I've had something done. But if you work with someone who has an eye for naturalism and a real talent for aesthetic work, I think that you're always going to be in good hands, and you're always going to get a result that looks like you, just more refreshed, more youthful, and the best version of you.
Yeah.
So
and
not
is
done.
there an age that people should start thinking about these aesthetic treatments, or is it really open to anyone?
That's a great question. I think the earlier someone starts in the process, the more you can gradually take them where they need to be in a very natural fashion.
And preventative is perfect for down the road as well.
So Botox is a wonderful example of, you know, preventing lines and wrinkles from ever occurring. I started myself with Botox treatments at age 28, and not a line on this
just very quickly before we go, you have an
sure.
event coming up in January. Tell us a little bit
absolutely.
about that.
So we are hosting an aesthetic event at the office. It's to introduce me to the community.
Oh, beautiful.
And I'll be doing live injection demonstrations at the event. We'll be doing office tours. We'll be doing lots of giveaways and special deals for people who are interested in getting aesthetic treatments.
Well,
Absolutely.
we might get Madam over there.
I'll probably get you.
Yes, please come.
Anyway, thanks for coming in.
Thank you.